At a Senate Appropriations Committee hearing, Senator Gillibrand questions VA Secretary Collins about the return to office policy at the VA.
Because of this policy, many VA psychiatrists and therapists were forced to conduct sensitive telehealth appointments from crowded offices, violating ethics regulations and standards of care. Do you agree that veterans in need of mental health care deserve easily accessible treatment from qualified professionals with a guarantee of confidentiality?
Every veteran, no matter what their care is, deserves the best treatment they can. But any of our telehealth workers or anybody that was treating or even talking to someone in a facility like that was going against our policy and shouldn't have been in that position to start with.
Gillibrand raised concerns about mental health workers conducting telehealth interviews from cubicles.
Are you hearing anything about harms related to the return to office policy with regard to space, specifically for mental health practitioners?
No, we've actually, what we're doing is there's a lot, just because of space in some of the building facilities over the past few years have been gone. So there's a lot that we still have not brought back in, and we're exempting certain areas. If they can't come back in, we're exempting those. Because, again, if it's in the policy, we're going to make sure that the policy's followed. And if it's not, I want to know that. So we're right now it's working. There's still a lot out there that's left to be done. But we're making this adjustment because we want the best health care. We also want the employees to have the best workplace.
Well, I would urge you to look specifically for the mental health providers, because when they can offer their counseling services from home, it's entirely confidential. There's no one in the cubicle next to them. There's no one overhearing the problems.
And I agree with that. And as someone who is a chaplain in the military, whose confidentiality issues I've known a lot before, look, we believe that it's best served in a facility such as a hospital, which is secure. I'm not going to question anyone's home environment, but there is a possibility there at home. If it's not secure, you have anybody walking in, family or others coming into that as well. So we believe that the best places for that is in a VA facility working in tandem. So I agree with you. We want to do that,
Yep.
But we also need to make sure it's not just in a employee convenience, but it's also best for the veteran as well.
Right. So then you should do a full analysis of your space allotments for mental health, because as a chaplain, you wouldn't expect to be giving people faith advice when someone can overhear your whole conversation.
And that's why in fact, we've done that. I'll be happy to have our staff come and show you what we have done on our office space environment, how much what has been done across the country on what spaces are available, not available. And like I said, any place you have, Senator, and I want you to know this, if there's someone brings forth something that is,
we've
is
heard
not
many
then
reports.
please bring it to us, because because that's against policy, and I can't go against that.
For more Congress clips, stay right here, and thanks for watching.